Could you please explain to our viewers in simple terms what palliative care is all about?
Sure. All of us are going to age. And when all of us age, what happens? Your vision comes down, your auditory senses come down, that is, you can't hear completely, your knee starts paining, right? So, a simple aging process can bring in a lot of discomforts. Now, normally a family would want to run from one doctor to the another doctor, thinking that it's a disease. It's not. It's age related condition. Okay. Now, when we uh, talk of palliative care, we are talking about what happens to a patient or a person who has been diagnosed with some chronic condition. What is a chronic condition? Condition that persists for a long time, where you can manage it with drugs. For example, I'm diabetic, so I'm palliative. I have to alter my lifestyle, I have to work on my diet, right? That'll help me to lead my productive life long time. So there are different chronic conditions. But today we are here specially to talk about palliative care in the oncology setting. Okay. Now, cancer is one disease where the treatment is even more severe than the disease itself. The amount of symptom which a patient has to suffer and treatment induced side effects which the patients have to suffer and their families who are taking care of them also have to suffer, palliative care is an answer. Now the next thing is, when we talk about palliative care, we have medical aspects, the physical discomforts, the physical symptoms which is caused by the disease and by the treatment, they are handled by the palliative care physician. Now, you have a disease, you have a cancer in a particular place, and thankfully the doctor has treated it. What happens? You think the journey has ended there? No, right? You might sometime experience, is this disease going to come back? You have one little fever and you're scared. Oh my God, am I going back the same road? Then your lifestyle is so much altered, okay, depending on the disease. For example, if your disease somewhere in the oral mouth area where you can't speak, you can't chew, you can't bite, and you're absolutely a foodie, what happens to you? And because of the radiation, one of the treatments, your face is absolutely disfigured, and you're a very popular person with all your friends. What happens to you? You don't want to go meet them again, because for you your body image is very, very important. So isolating yourself from that crowd causes a lot of social pain. Okay, how many times my family said, don't do this, eat good food, whatever it is, right? I used to be a chain smoker. uh, they said don't smoke, don't have habits, but I could not. I got into habits so much that I could not really take care of it. Now I'm feeling guilty, emotional pain. Then I go to God. I said, am I the only person who has done all these things? There are so many people in this world who are smoking and drinking and they are walking so freely outside on the road. Why me? You're addressing God. Your distress is towards God. I'm such a nice person. Every morning I get up, I do puja of Kalima. Then only I come over here to the hospital and I've been serving so many patients. Why are you punishing me for that? So that is the spiritual distress, pain from spiritual dimension. And then the most important thing is your existence. I struggled all my life. I sacrificed so much. I focused so much on education to setting up something, realizing my goals. Finally, after all that, I have to suffer this. Why me? So, as a human being, you suffer. As a patient, your symptoms are taken care of. But lot of other factors which you as a human being you suffer is what we addressed in palliative care. So doctors look at the physical symptoms and we psychologists look at psy- psycho socio spiritual dimension. So just to understand, normally the medical aspect, the care has been focusing only on biological model, your body, your organ, your disease, and a cure. They forgot the human part of it. But in palliative care, we are telling you that we perhaps cannot change your destination wherever the disease takes you, but we can definitely impact the journey, how you travel a journey. So, three important things you have to understand in palliative care is excellent symptom control. Secondly, is quality of your life. No matter how long you're going to live, are you able to lead your activities of daily living by yourself as much as possible, and dignity, right? We want to restore the person's personhood and not remember him or her only as a patient always. This is palliative care.
Right.
I hope I'm clear to you.
Yes,
Yeah.
that was a great explanation.